anti-aging industry grossed over an estimated $291 billion worldwide in 2015, as about 78 million baby boomers reached out to the healthcare providers and doctors in their search for fountain of youth. There are so many options available, like fillers, lasers, and expensive creams and lotions, which can be very confusing. So let us meet our expert, Dr. Rosie Sandhu today, who owns Neem Med Spa, and find out what works and what doesn't, and what are the non-surgical options available for anti-aging. So Dr. Sandhu, welcome to the show.
Thank you very much, Manju. Thanks for inviting me here.
Thank you so much. So we know that diet, exercise, sleep, and good genes are the key factors to anti-aging. But what are the medical options that are available in the anti-aging process?
Absolutely, Manju. And to really answer your question about the medical options available, I think it will be very prudent to start off by just talking about and briefly discussing what the aging process is all about, and why do we age, and exactly what are the factors that are leading to the aging process in the human face, so we can talk about how to reverse it.
Sure.
And really, it starts very early, much earlier than you and I even think about, from our very early 20s. In fact, even you'll be surprised to hear, as was I, that in our starting from our early 20s, we start losing about 1% collagen every year.
Wow.
So just think about it. By the time you're 60, you hardly have any
Right.
left. So really, all kinds of modalities, whether they can be energy-based technologies or creams or lasers, which are targeting neocollagenesis, which is making new collagen, is really the foundation.
Okay.
And in fact, I see the whole process of anti-aging. I think it's based on the pillars of the 3 Fs.
3 Fs.
Yes.
Okay.
And that's my mantra as
Okay.
I understand aging and the anti-aging world. And from the 3 Fs, it's really the first F is the foundation.
Foundation.
From foundation, I mean laying the collagen, which is the building block of your skin.
Okay.
The second F is filling, which is
Okay.
because we are losing collagen,
Okay.
so we're really losing that fill to the skin that we have when you have a youthful look to your face. And the filling really includes the dermal fillers that we have today, and the neurotoxins or the neuromodulators like Botox, which everybody knows about.
Sure.
The last F, which is again very, very important, is the finish. And the finish will include your lasers, which we will briefly touch upon, and chemical peels and your skincare products.
Okay.
So once we have, and all these 3 Fs are important, and I think they need to be started in a chronological, in a systematic fashion to get the best results.
So let's start with the first F.
All right. So the first F, or the foundation, is where we target to making new collagen.
Right.
Because unless you do that and you start off with your finish or filling, those are temporary solutions. And from your foundation, we will focus on all technologies that we have in today's world, without taking up all your time today, on making new collagen.
Okay.
So most of the techniques that we have are using energy-based devices.
Okay.
And these are in the form of ultrasound, really focused ultrasound, and the key technology for that in today's age is therapy.
Therapy.
Yeah.
Okay.
So therapy is using focused ultrasound energy, and we know ultrasound has been used for years, and it's very safe. If it's safe enough for a baby, it's safe enough for you and I.
Sure.
So we used focused ultrasound waves, which reach about 4.5 millimeter under our skin to the fascia, which is just covering the muscle.
Okay.
And it's really heating up the collagen fibers there to 60 to 65 degrees Celsius without damaging the surface skin.
Okay.
And when collagen gets heated up to that degree of temperature, the fibers, which is protein, they get denatured or broken.
Okay.
And the healing process of the body makes new collagen.
Okay.
And it's really the body's healing mechanism which is forming new collagen in a natural way. So you're not really using any chemicals.
Mhm.
You're using your own body's healing, and
Mhm.
because of that, the results are not instant.
Okay.
So
Okay.
the results will really start, and you need to be patient in the first few
Okay.
weeks at about 1 month, and
Okay.
they just continue to improve.
So how many sessions do you need?
So that's the amazing thing about our therapy. It's
Uh-huh.
just one treatment.
Okay.
So it's one treatment. It will be about 30 to 60 minutes, depending on which
Okay.
area we are treating. And in the next 3 to 4 weeks, you start seeing a tightening to your skin and a lift as well.
Okay.
And the results will just continue to improve until up to 6 months when you get the best results.
Best results. Now, is it painful?
So it's definitely not painful, but
Okay.
yes, it does get a little sensitive in
Okay.
certain areas. So the way we instruct our patients is that to take a Tylenol and maybe an
Okay.
ibuprofen before the treatment, and then during the treatment, I've not had anybody having a difficult time. You may be a little sore in some areas for the next 2 to 3 days, and ultimately everything gets better.
So my
And
next
it's
question.
it's worth the pain.
Since my husband would say, is it painful to the wallet? How expensive is it?
Definitely.
Uh-huh.
So it's definitely not cheap. I would
Okay.
say on average, if you are treating the
Mhm.
full face, the treatment would range anywhere between $2,500 to $3,500. Having said that, you can always break the areas into smaller pieces.
Okay.
Like for you, if let's say for you or me, if the issue is your brows sagging, then you just get your brows done. Or if for
Okay.
someone it's the lower face being an issue and the
Mm.
jowls are bothering you,
Okay.
then we just focus on the lower face. And per treatment, if you break it up into areas, and I would say it ranges anywhere from 500 to 1,500, so much easier.
Much
on-
easier,
Yes,
much easier.
on the wallet.
Okay. Now, anything else in your first foundation? That was
So again, different energy devices. So ultrasound is the first source. The second source is RF or radio frequency. Again, completely extremely safe treatment, and the idea remains the same. We're in this modality, we are using radio frequency to
Okay.
heat up the target tissue, which is your subcutaneous tissue.
Mhm.
And we are heating to 42 to 45 degrees
Okay.
Celsius. Again, we are denaturing the collagen fibers because it's not heating the subcutaneous fat to that degree. You're not really getting the lift, but you do get a good tightening effect.
Okay.
And again, the results take about a month to really appear, up to 6 months to maximize.
Okay.
And with all these technologies, the results, the best part is they last about 3 to 5 years.
Oh, good, good.
Yes, and then of course everything's variable. If you have someone in their 60s with more laxity, they need a touch-up treatment at 2
Okay.
years compared to somebody in their 30s or 40s.
Okay.
But I would say there's really no soon time to start, because if we start taking care of the collagen from our 30s and 40s, you really will not get to the degree of laxity
Okay.
when you're in your 50s and 60s, and you really
Need
value
it.
what you did, what you did at that time.
Okay.
And so mostly ultrasound and radio frequency are the two main ones. We also sometimes use lasers, but lasers will be more useful to talk about and superficial, the
Okay.
finish
The
part
finish,
of
okay.
my
So let's get to the second F, the fillers.
right. So the filling aspect, I would include both the dermal fillers and the neuromodulators for wrinkles. So there are different kinds of dermal fillers these days. My favorite ones are the hyaluronic acid
Okay.
fillers.
Okay.
For instance, if you've heard the names of Juvederm
Yes.
or Restylane or
Right.
Belotero. The reason they are my favorite is that they are all temporary fillers. So let's say
Mhm.
if you did it on an
Mhm.
impulse and you did not like the result or you were not okay with it, then it's not something permanent. Hyaluronic acid is a natural substance
Right,
we all
right,
have in our
right.
skin anyways. So it's really giving, and again, like collagen, we are losing hyaluronic acid from our early 20s. So the idea is we inject hyaluronic acid
Uh-huh.
in the areas where you start losing volume.
Mhm.
And volume loss, as you know, is one of the first signs of
Right.
aging as
Yeah.
well. We start
Right.
losing volume in our anterior face here.
Right.
over here as well, and then the marionette lines
right.
in this area.
Right.
So we would inject the filler. Most of these fillers, they last about 6 to 12 months.
That's not bad, right?
Yes. And then you need another treatment for it. But the results are really very good. And once you fill the hollow areas, the next thing will be, depending on your temperament, I can tell as you're a happy person. And after years of smiling and laughing, and the repetitive expressions that you make, we form the lines, the smile lines. Or if you're a person who's easily stressed or is living in a lot of stress, like I do, so then you may get the angry 11s or the glabella lines that bother. Yes.
Okay.
So these are the lines that are treated with neuromodulators like Botox. What it is it's really botulinum toxin protein, which is purified, and it temporarily paralyzes the muscles which are making these expressions. It's completely safe. There's a lot of, I would say, nervousness and anxiety in some people about, will it give me food poisoning because it's a toxin, it's a poison. It's not a poison. It's definitely a purified protein which is procured and chemically engineered later on, and then and very, very safe. In fact, we've been using Botox since 2002 for various conditions. And you will have the results of just eliminating all these lines for 3 to 4 months.
I think when Botox first came out, there was a lot of operator dependence, and you would see cases of lid drooping and all, which was very scary, right?
Yes. And that's an excellent point to make, that you need to be careful about your provider. It's easy for someone to just go get it done, thinking that, okay, if it's a less trained person, you may get it cheaper, but just think about how important and how valuable your face is to you. So you need to make sure the provider that you're going to, the nurse, the doctor, the plastic surgeon, they are well trained. They've done, it does not hurt to ask how long they've been doing it, how many people they've treated, and see before after pictures.
Absolutely. So what is the final one?
The last F, or the finish, is really, it's again multi-modality treatment. So it will include your lasers. So the lasers are going to be, there are different kind of laser treatments, ablative or non-ablative, depending on, do you want a quick result but with some downtime, or are you okay with results that are slowly building up but there's no downtime with them? And if you've heard about Fraxel, which is the most common Fraxel, that is using fractional energy for resurfacing your skin. So any kind of texture issues, if you have uneven texture, big pore sizes, or fine lines, those are where the laser technology is very helpful. So we use the lasers for all superficial skin issues, pigmentation issues, acne scarring, any kind of chicken pox scarring, for stretch marks. For all these issues, lasers are the treatment. And then we have our chemical peels, and chemical peels are again for pigmentation issues mostly, and the tone and texture.
And there is a lot of concern because the Indian skin is very different from white skin or Caucasian skin. So what are the what precautions do you take for Indian skin?
Absolutely, that's a great question, Manju, because being from Indian heritage myself, that was one of the things that I was very careful about. Luckily, we are in the era where the laser technology has been advanced so much that today we have lasers which are suitable for your Fitzpatrick skin type 1, which is the Irish white skin, blue eyes, all the way through African American skin. So for Indian skin, you need to be careful that you have the 1064 or the YAG lasers, which are very safe, and just go to a provider who has experience treating people with color as well. And then these lasers are very effective, very safe on Indian skin types.
And are there any conditions that Indians are prone to, or any adverse effects like hyperpigmentation and things like that that we are more prone to?
As you very rightly mentioned, and not just Indians, anybody who has a darker skin type, hyperpigmentation or even hypo, which is less pigment, those are the concerns that people will have with darker skin types. So once again, although the YAG lasers are very safe, but it's a possibility. So my suggestion for people who want to grow but are hesitant about these treatments would be to do a patch test.
Okay.
So first go in and just have a patch of your skin treated, which is not something that's going to be obvious. So if you wanted to do it on your elbow or your shoulder or behind your ear, so just get a small area tested first. And then if you're fine by the next day, then I think it's absolutely safe and you'll be okay.
So tell us about some of the skincare products now.
Sure. So I would like to divide the skincare products into prescription and non-prescription.
Okay.
So if you're otherwise generally healthy, you don't have any skincare issues like pigmentation or acne, I would say that to maintain your skin health and prevent aging, we all since our late 20s need to start using retinol.
Okay.
And retinol can be prescription or it can be over the counter.
Okay.
When you're young and otherwise healthy without any skin concerns, I would say just over-the-counter retinol from companies like Neutrogena, L'Oreal and Olay would be a pretty good strategy and a good approach in the very beginning. And then if you have more texture issues, that if you have uneven skin texture or any scarring and you want that cell turnover in the skin to really ramp up and increase, then that's the time to invest in prescription skincare products like Retin-A or tretinoin. So that's like if we were to really divide skincare into the 3 F's like we did earlier for anti-aging technologies, retinols would be my first modality. The second modality would be vitamin C, which is really for hydration, brightening of the skin and dealing with any pigmentation.
Okay.
If there is more pigmentation than what vitamin C can really cover, then you need to add on a hydroquinone.
Okay.
And at least 4% hydroquinone, and that's something again prescription that you would get through your doctor, would really work wonders for any kind of pigmentation.
Okay.
And lastly, but not the least at all, would be your sunscreen.
Sure.
And I cannot emphasize how important sunscreen is. And all days of the year, whether it's raining outside, snowing outside, which is not at all unusual in Boston. Yes. I think sunscreen is very important because we are always getting the harmful rays. And when you're buying your sunscreen, whether it's something over the counter or through a prescription from your doctor, we need to be careful that it's covering both UVA and UVB rays. And it's at least SPF 30 or above.
Okay.
And you need to also read the label carefully to make sure there is some physical sunscreen in it as well. And when I say physical sunscreen, you really need to make sure there is either titanium or zinc oxide in it. And if you're doing that, I think, as we say that an ounce of prevention is better than a pound of cure.
Right.
I think you will be fine for years to come.
So that's wonderful. And now that takes me to our next anti-aging topic, which I think might be more dear to men, though women also, is hair restoration. So tell us what the modern medicine has to offer for hair restoration.
Oh, I'll be happy to. First of all, let me just start off by saying that it's a tough condition.
It is.
There is no easy way of doing it, but in fact in today's world and with the technologies we have, there definitely are many more solutions than what we had 5 years ago. And of course, till now, the only go-to treatment used to be hair transplant. And hair transplant again is something not easy. First of all, many people fear the cost involved, the downtime, the scarring, and even the accessibility of it. So if you don't have any hair follicles in your scalp and it's too late at that point for anything less invasive, I think at that point, hair transplant is your only solution. But for people who start seeing thinning in their hair, especially at the back of their scalp or frontal receding, especially for women.
Absolutely.
And I'll tell you this, Manju, but I used to think that, okay, when I started learning all about hair restoration, I thought it's a men's condition. But you will be surprised that every day I see a whole lot more women who are bothered by hair loss than even men. because it's again hormonal. Women start losing their hair in their 40s, 50s, especially
Yes.
after menopause as well. So the wonderful treatment that's come into existence in the last few years is called PRP, or platelet-rich plasma. And platelet-rich plasma is your own blood that we withdraw from you. And the blood is centrifuged in the centrifuge machine so that the red cells are separated from your plasma. And the plasma is rich in platelets, and this is the product, this is the part of the blood which is very rich in stem cells.
Okay.
And the stem cells encourage and promote growth of the hair, new hair follicles, new cell turnover, and even collagen regeneration.
Okay.
So these days we are using PRP for skin rejuvenation and for hair restoration.
Okay.
And what we do for our hair restoration patients is that we bring them in and we take the plasma, and first we microneedle the plasma in their scalp. And microneedling is a very non-invasive, low pain procedure where we use a pen which has about 11 small microscopic needles, and we use that pen is rotating at very fast speed to really infuse that plasma inside your scalp. And after that we take a very small needle and we inject the plasma in the area of hair loss or hair thinning as well.
Okay.
And as we do that, along with it, it's a 3-month program where you're taking oral supplements which are essentially vitamins like biotin, B complex, which will promote hair growth, and topical products like minoxidil and Rogaine that you will be using, and the results we are seeing are just fabulous.
Okay. There's a lot of talk about the skin, hair and nail vitamins like biotin. Do they really work well?
They do. They definitely do, but not in isolation.
Okay.
So if you're taking biotin on a regular basis, it's definitely good for you.
Okay.
But by itself, if you're losing hair, it's not going to be enough to really restore your hair. So I would say that you need to have the other treatments for increasing your hair growth, and in conjunction, taking biotin is definitely a good idea.
Okay. Any other suggestions for anti-aging for our viewers?
I would say really take care of the body as a whole. You need to eat healthy, exercise, and start early in taking care of your skin. Don't wait until it's too late. Don't wait until you're in your 50s or 60s to really invest in your skin health, but start early in your 20s and 30s, and then you won't reach a stage where you will be regretting it later on.
And sleep well, cut your stress.
Absolutely, I can't tell you more about it. Definitely healthy habits, meditation, yoga, exercise, low stress life, and eating healthy are things that we all need to be doing.
No smoking and no alcohol.
I agree with you completely.
All right, so we look forward to your talk on the Health Expo, April 3rd. Thank you so much for coming.
Thank you for inviting me, Manju.